Hello everyone, my name is Amanda Manzano, and in this video, we're going to be talking about the use of expressive arts for stress management. So let's get to it.
Let's talk about what exactly stress is. Stress is the body's reaction to any change that requires an adjustment or response. Everyone experiences stress, and some stress is even beneficial. Stress can be a great motivator to get things done, and many say stress is even essential for our survival because it triggers what we call the fight or flight mechanism. Stress can also be detrimental to our health. When there is an extensive amount of stress affecting the body, we call this distress. Distress can disturb the body's internal balance or equilibrium, leading to physical symptoms such as headaches, an upset stomach, elevated blood pressure, chest pain, sexual dysfunction, and problem sleeping. According to the World Health Organization, stress is currently the world's most prominent health risk. Managing and reducing stress is extremely important, and one way you can do this is through the use of expressive art. What is expressive art? Expressive arts uses art disciplines such as visual arts, music, poetry, dance, writing, photography, or drama to assist individuals to make contact with their authentic self. Expressive arts are used as therapeutic media when the purpose of using art is to foster change in people. Individual changes may include enhancements in cognitive, physical, emotional, or social functioning. The process is therapeutic in that it is multisensory, containing sensory, motor, and cognitive skills. There has been evidence that engaging with artistic activities, either as an observer of the creative efforts of others or as a creator of one's own creative efforts, can boost one's moods, emotions, and other psychological states, as well as have a substantial impact on essential physiological limitations. Art can be a haven from the powerful emotions associated with stress. By participating in this intervention, individuals can focus on positive life experiences, enhance their self-worth, maintain their identity, and express their feelings in a symbolic manner. Now, we'll talk a little bit about the history of expressive arts. Expressive arts as therapeutic media began as a way to facilitate positive changes in the physical, social, and emotional functioning of a person with a disability. Evolving from art therapy, expressive arts were used in institutional settings as a diversional activity to assist people in passing time. During World War II and through the 1950s, healthcare professionals recognized that art activities, as well as other recreational activities learned by people who were recuperating, could be used to develop skills useful after discharge. The beginning of civil rights-related laws from the 1960s to 1990s introduced and furthered the inclusion of people with disabilities in school and community-based art programs by mandating non-discrimination of people with disabilities. Through inclusion of people with disabilities in art-related classes and programs, use of expressive arts as therapeutic media extended opportunities to use art-related skills learned in institutional settings. The following are 3 studies on the use of expressive arts on different populations. Study 1. Beasley and colleagues examined effects of a 16-week visual arts program that took place one time a week for 2-hour sessions on quality of life and well-being of 11 people who experienced a cerebrovascular accident, who were medically stable, had no aphasia, and living in the community. They were recruited to participate in this study through community support groups. An artist facilitated intervention along with a member of a multidisciplinary team that assists individuals who have had strokes to live independently and an assistant. Each session used a variety of art mediums including painting, charcoal, sculpting wax, and drawing. Immediately post-program, focus groups were conducted with participants to understand their experience in the art program and its effect on their functioning. Follow-up individual interviews were conducted 3 weeks after interventions ended at participants' homes to understand their perspective about functional improvement. 4 themes emerged from the data, including experience of stroke, benefit of art, benefit for self, and benefit of group experience. Participants expressed that they felt an improvement in their self-confidence to try new things, experienced self-efficacy in relation to art skills, and perceived that participation in this program improved their quality of life. Study 2. White and colleagues conducted a case study with a woman diagnosed with a learning disability and cerebral palsy to examine the use of long-term art therapy on the development of coping skills. Over 4 years, the woman participated in art therapy once a week for 1 hour. The art therapy interventions included use of paints, clay, and felt pens to create visual art that reflected her feelings, experiences, and perspectives of her life. Counseling and debriefing occurred at each session. Recordings of session conversations were transcribed and analyzed using constant comparison methods. The woman reviewed the analysis to assure analysis reflected her experiences. The woman developed useful coping skills in learning to accept limitations and strengths associated with her disabilities, as well as live a satisfying life. She reported that the art therapy sessions provided a way for her to express her emotions, overcome anxiety, and learn useful coping skills. Art therapy helped her develop adult relationships with family and friends, an issue she had difficulty with prior to therapy. White and colleagues noted that art therapy was helpful with this individual and recommended use of this expressive art to help people with disabilities to voice their feelings, anxieties, and learn ways in which to learn coping skills to live a more fulfilling life. Study 3. Nursing students are more likely to experience stress during their education and training. Various stress management interventions are currently being used by the educationists to reduce the stress among students, and expressive emotional writing is one of them. The current study was planned with the objective to assess the effectiveness of expressive emotional writing on perceived stress and general well-being of nursing students. The Perceived Stress Reactivity Scale and General Well-being Scale were used to assess the stress and general well-being of the students. 4 sessions of expressive emotional writing in an experimental group and neutral writing in a control group were conducted for a duration of 20 minutes, each once a week for 1 month. The subjects in the experimental group showed a statistically significant increase in perceived stress reactivity after intervention. However, on the domain of general well-being, there was statistically significant improvement in general well-being of the experimental group. Results show that expressive emotional writing is effective in improving general well-being of the subjects. The following intervention program is called Expressive Arts for Stress Management. In this program, the use of visual arts through painting, coloring, and drawing will be used, as well as expressive writing exercises. The program will last for 4 weeks with 2 30-minute sessions per week. The first 30-minute session of each week will consist of the writing portion of the program, where participants will be given writing prompts and the entire session to acknowledge, examine, and analyze what they have written alone and/or with the recreational therapist. The second 30-minute session of each week will consist of the visual art portion of the program, where the participants will have a different assignment each session that they will work on during their session. Writing prompt. Write a list of all the stressors in your life. Next to that list, write about ways you can solve these stressors. Assignment. The participant will be given a canvas, paint, and a mallet to use for this session. The participant will choose 3 colors of paint and then proceed to make a shape on the canvas by placing drops of each paint color till their shape is complete. Then the participant will use the mallet to smash and blend the colors together, releasing built-up stress and expressing creativity. Writing prompt. Write down everything, big or small, that you've achieved in your life. Art assignment. Provide the participant with a sheet of paper, a Sharpie, and colored markers. Ask the client to draw lines all over the paper and intersect them in any format they like. Once they are done, ask the client to color in each open space with the colored markers. Writing prompt. What past challenge has turned out to be a gift in disguise, even if it's still painful? Why? What was the silver lining? Art assignment. Give the participants a sheet of paper and colored marker of their choosing. Inform the client that they will be drawing a flower that will reach to the edge of their papers. Ask the participant to draw a quarter circle on one corner of their page and then begin to draw the petals outwards towards the other edge, progressively increasing the size of their petals. Writing prompt. Write about a stressful situation you have experienced. Proceed to write about a magical door that can lead you to a peaceful and serene space away from your stress. Be sure to describe in detail this peaceful space in your writing. Art assignment. Provide the participant with a sheet of paper, watercolors, a brush, and a glass with water. Instruct the participant to dip their brush in the water and choose a color, and then proceed to dip their wet brush into the color so they have some on their brush. Ask them to paint a circle on their paper. Ask the client to clean their brush and pick a new color and proceed to dip their brush into that color. Bring the brush back to the paper and paint a smaller circle inside of the circle you already painted. Continue this process till the page is filled. After each session, the participant and professional will discuss about their stress levels and what they thought of the activity.